Hello everyone, good morning, good afternoon, good evening, wherever you are at in the world. Let's go ahead and begin with a test question. A patient is getting Zostavax, aka shingles vaccination. They ask you, how long will this last me? Which of the following would be the best answer? A, 2 years, B, 5 years, C, 1 year, or D, 10 years? What's your answer? If you answered B, you are correct. Now, I do want to talk about the shingles vaccination, which there are two. I do want to talk about them both in this video, but to begin with, I want to start off with what is shingles. Now, if you've never heard of shingles before, it's something that, it's very common actually. It's caused by herpes zoster, which is a virus. It's another name for shingles. And this is basically a viral infection that can cause a very painful rash. Now, the rash is often accompanied with symptoms such as tingling, burning, and or numbness in an area, and it usually stays on one side of the body. A lot of times people, they may even have the numbness and tingling before a rash even starts. The rash is often described as a cluster of vesicles, or blisters, on one side of the body. And sometimes it's itchy, and even people explain that it's very sensitive to touch, very tender. The pain is the main thing that I often hear from people that they talk about. Let's talk about other symptoms. Sometimes people have fever, chills, headache, photophobia sometimes, fatigue. Fatigue seems to be a big one. Now, how do you get shingles? Now, shingles is caused from the chickenpox virus. Yes, I said, you heard that right. Chickenpox virus. This virus is called varicella zoster. So, if you've ever had chickenpox before, and most people in the population have, some studies have shown that approximately 99% of people, the population, have actually had the chickenpox virus. I don't know exactly how you measure that. But if you have had chickenpox, then you can potentially develop shingles later in life. This virus hangs out in the body and it may be reactivated later in life, thus leading to a shingles outbreak. One question that is often asked about shingles is, are you contagious when you have shingles? So technically there are two answers to this question, yes and no. Technically, if shingles is not contagious as far as passing shingles and giving another person shingles. However, if you have not had chickenpox and you're around somebody who has shingles and you get exposed to that, you can catch chickenpox. And you are exposed to open sores of someone who has shingles, you may actually get chickenpox. Now, it would be quite unusual to not have had chickenpox, but hey, I suppose it can happen. You might be that 1% of the population that has not been exposed or had the virus. The key point here, though, is that most of the population has actually had the chickenpox virus, and they may or may not have developed the rash that people usually develop when they get chickenpox. Next question. When does the rash go away? Now, typically the rash scabs over in 7 to 10 days, and it's usually gone by 2 to 4 weeks. Next question. So if I haven't had chickenpox, does that mean that I won't get shingles? Anyone who has had chickenpox is at risk to develop shingles. Now, approximately 95 to 90% of the population has had the chickenpox virus, as mentioned earlier. But some people may not even know that they've had it. This is also something we mentioned earlier. Per the CDC, approximately 1/3 of the population will get shingles in their lifetime, and approximately 1/3 of those individuals who develop shingles outbreaks will have serious complications from the disease, such complications as pneumonia, bacterial skin infections, painful herpetic neuralgia, vision loss, and many other complications. This is why it's so important to get the shingles vaccination. Now let's talk about the vaccinations. The shingles vaccination, there's actually two different types of shingle vaccinations currently available. One is called the Zostavax, and this came out around approximately 2006. And then the other one is called Shingles, and it came out, I believe the FDA approved it around 2017. And it's actually considered, the Shingles is actually considered more effective at preventing shingles than the Zostavax is. But let's talk a little bit about these two. I wanted to make a table that gave an overview of the comparison between the two. So first thing you see, obviously, that the Shingrix is a dead version and the Zostavax is a live weakened version. Effectiveness, it's very obvious here that the Shingrix, it appears more effective based on studies, and I think some of that has to do with the fact that you're getting 2 doses, you're getting that booster 2 to 6 months later. And with the Zostavax, you're only getting 1 dose. When do you get these? In the Shingrix, it's considered most effective when you get it at 50 years plus, and the Zostavax at 60 years plus. The CDC recommends that the Zostavax stay at 60 years and older because they were concerned that the immunity would wane and that there would be a number of people who were vaccinated in their 50s who wouldn't be protected in their 70s. And this is by Kenneth Schmader. I hope I said that correctly. This is interesting to me because just wondering what the difference is between the 2 vaccinations, why you get one at 60 and one at 50. Now, with age considerations, the Shingrix, it's still effective at 70 years old, and that's super important because as you get older, you're more likely to develop shingles and also the complication from shingles. So I believe I read some different places that said anywhere from 85 to 91 or 89%, somewhere around there in that range, percent effective in 70 years and older. So that's important to think about. Now, in the Zostavax, not quite so much. I don't have exact percentages on that, but I know that it definitely is less effective, and that's why they do want you to get it at 60 years instead of 50 years. I'm going to skip past when it was introduced and how long it lasts to side effects. Now, there are actually, what I've read, more side effects with the Shingrix than the Zostavax, and it may be because you're getting a booster as well. But most side effects were very mild and symptoms went away on their own in 2 to 3 days. And the side effects tend to be more common in younger adults. And with the Shingrix, approximately 1 out of 6 people develop some type of side effect. A lot of times it's just soreness at the site. Sometimes it can be headaches. Sometimes it can be fever. Some people had nausea. Some people felt really tired. So moving on, let's talk about, if you have had the Zostavax, can you have the Shingrix? And the answer to that is yes, but you should wait at least 8 weeks between the 2. Question, should I get shingles vaccination if I've had shingles before? Yes, it's recommended that if you have shingles previously that you still get the vaccination. Some people do develop shingles more than once in their lifetime, and it can be extremely painful. Many people suffer from something called Postherpetic neuralgia, which is a serious nerve pain that can last for months after the shingles outbreak. And the shingles vaccination, the nice thing about them is they protect you from not only just getting shingles, but also from developing that, we'll call it PHN. The postherpetic neuralgia is one of the most common complications from shingles outbreak, and it's very painful, and a lot of people have decreased quality of life because of it. If they be put on medications for that nerve pain. The important fact to realize about the PHN is that the older you are, the more likely you are to develop it after shingles, and it's likely to last longer too. Now, if you are under 40 years old and have a shingles, you're less likely to develop the PHN, but that doesn't mean that you can't develop it. Some people do. The great thing about the shingles vaccination, as I mentioned, is it helps prevent some of these serious complications. I'm glad that you watched this video. Please share this information. This is super important. We have something to prevent the shingles, which can be very miserable. So definitely I recommend, if you're within the age range that was mentioned, to talk to your doctor or practitioner about these vaccinations and see if it's right for you. Definitely they are well worth it. I've heard many people who are very happy that they decided to get the shingles vaccination. One thing to consider is there's no 100% vaccination, so you still can potentially get shingles even if you've had the vaccination, but this is something that does help bring the risk of you getting it down to a very low percentage. So that's the important thing. Well, please make sure to click subscribe, hit the bell for notifications, and give this video a thumbs up if you did enjoy this video. We can make more of these. If you have suggestions, put them in the comments below. We would like to hear what you would like to see, and stay tuned for more medical test questions from Med Made Easy.